Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you once again for having me on the program.
Yes, sir. I wanted to start off with the Covax mechanism. Guyana has finally gotten its 24,000 doses. Could you give me your general thoughts? And just for clarity, it's 24,000 vaccines or doses?
Well, thank you very much for that question. As you know, we have been engaging Covax for a while now, and Guyana is one of 10 countries in this region that is going to get vaccines through the Covax AMC mechanism for free. Initially, Covax has allocated to Guyana for us to receive at least vaccines for 20% of our population. But I suppose because of the global demand and the challenges that they have encountered in accessing vaccines, that they had to reduce the amounts of vaccines that are coming in the first tranche. We were told that we were going to get initially 100,800 doses, and then that was reduced to 33,000 doses, and we have finally received 24,000 doses. So we are very excited, we are very pleased that the process has started, and this was the first set of doses that we are receiving from the Covax mechanism. And we have been told that over the next couple of months that the other doses would be coming in as more doses become available to the Covax mechanism. I want to express my profound gratitude and that of the government of Guyana to PAHO, WHO, and to UNICEF and all the other partners in the UN family for assisting us in getting these vaccines to Guyana. As you know, COVAX also, that coordinating mechanism is made up of about 4 different organizations, and they have been trying to leverage vaccines globally and to make it available to countries around the world so that there's some equity in the distribution of these vaccines. So we're very pleased that we've been able to access the first tranche of the vaccines from COVAX. And of course, we have been using the AstraZeneca vaccine here, so our staff, they're well prepared to administer the AstraZeneca vaccine. And so we see the rollout of this to be quite seamless. So with 24,000 doses, we'll be able to fully immunize 12,000 people. We will start administering these doses during this week, and then we'll wait between 8 to 12 weeks when we'll give the second shot. So I think this would certainly help to enhance our vaccination program here. And then later in the week, we are also expecting the Sputnik doses to start flowing.
All right. But while we're on vaccine, how has the campaign been going thus far?
I think it's excellent. We have had a lot of uptake, people coming forward to get their vaccines. As you know, with the first 40,000 persons that we would have given the AstraZeneca to. Again, we had 80,000 doses of AstraZeneca. We have released 40,000 doses so that we can immunize people and keep back 40 for the second dose. And similarly with the Sinopharm, we had 20,000 doses and we have released 10,000 so that we can give them the second shot. It has gone very well. In every region, we have teams that are operating. People are coming forward to get their vaccine. I think our constant challenge has been that people of different ages are coming, and we're trying to get people to understand that we wanted, first of all, to do this 60 and above age group, and as we get more vaccine, we'll lower it. As the President would have said last week, our intention, once we get in the additional Sputnik vaccines, is that we'll lower it to 40 and above. So we're working on that, but generally I think the uptake has been really good.
All right, and ever since we had gotten those from Barbados, so we already had people who did the entire double dose already.
Not yet, not yet. But shortly we'll be able to administer the second dose to persons. The recommendation is that the longer you, for the AstraZeneca vaccine at least, if you do it between 8 to 12 weeks, then the efficacy of the vaccines would go up. And that's what we want. We want maximum efficacy, and that's why we have increased the interval between the first dose and the second dose.
All right, if I could just shift a little bit, I wanted to go to testing. I noticed an ad out for another agency that will be doing the PCR, so I wanted to ask you your general update on who else is authorized to do PCR testing.
So right now for PCR testing, we have 4 authorized laboratories. The first one being the National Public Health Reference Lab, which is run by the Ministry of Health. The second one will be Eureka Medical Laboratories, and they have been doing PCR testing. The third has been Coastal Diagnostics, which has been granted a provisional license. And the fourth has been Sheriff Medical Laboratories, which have been granted a provisional license. So we have 2 additional, which is Coastal Diagnostics and Sheriff Medical Laboratories. Both of them have been given provisional license because we tend to assess on a regular basis until we are comfortable, and then we make sure they'll be granted the full license once they comply with all the things that we require.
All right, if I can just ask you to extend on the provisional license for me a little bit more, second.
Well, basically, they'll go through a period of monitoring. They have everything in place. They're able to do the tests. We are satisfied that they're able to do the tests. But we'll monitor for a period at least of 3 months, and then once they they satisfy everything that we are looking for and they maintain the standards that we require, then we'll grant them the full license.
Okay, sir. Thank you. I have some questions from the Guyana Chronicle.
But in addition to these laboratories, these are 4 that are doing PCR testing. We have about 8 laboratories and hospitals that are doing antigen testing. So again, while most countries require PCR testing for travel to the United States, you can do either PCR or antigen testing. So generally the antigen testing is much cheaper, so people prefer to do those when they're traveling, and they're easier to get. So they are available in a number of other laboratories.
And the records of these testing and so on have to be given to the ministry.
We collect data on how many tests are done at each of these labs. They're obligated to send that data to the ministry surveillance unit. So we collect that data, as well as if there's any positive, we are able to identify those positive and add them to our records, so that we are constantly updating the information.
Thank you, sir. The Guyana Chronicle is asking, after the initial 10 samples were sent to CARFA to test the presence of the variants, have other samples been sent for the genomic sequencing? Yes, I think I got that right. To CARFA or elsewhere? And I have a follow-up after that.
So CARFA was offering genetic sequencing, and we sent the first 10 samples to them. When we received the results from those 10 samples, they didn't find anything of significance. After that, for a little while, they had suspended the genetic sequencing at CARFA, or whatever relationship CARFA had with the laboratories that were doing the sequencing. So we weren't able to send back anything more to CARFA. They have since notified us that they'll be able to do some additional sequencing, and once we put all the arrangements in place, we'll be able to send samples to them. We have been also pursuing another arrangement, and that is to send samples to the United States, but we are still trying to finalize those details of how to get the samples up to them. So as of now, the samples that were sent for sequencing, whatever strain is circulating was the regular strain that has been circulating since December. So we didn't detect any change based on the CARFA reports.
Their second question is, with Guyana seeing a steady increase in the number of COVID cases daily, and it is known that there is an increase in transmissibility associated with the variants, does the ministry believe that the variants of the virus may be contributing to the surge?
Well, that question calls for speculation, and I wouldn't want to speculate. What we know is that if we are able to do the gene sequencing, then we'll know whether or not there are variants circulating. We obviously know that there are several variants that have been in circulation in different parts of the world, and they have various characteristics. So the variant that was discovered in the UK, the B117, that has shown to be more transmissible, and that is now in many countries around the world, right? But you need to do genetic sequencing to be able to identify it. The variant that was discovered in South Africa has additional characteristics, and in addition to increased transmissibility, it has also been shown that it can evade the immune system of the body. So that can prove challenging, especially we have seen some of the things that when they use certain vaccines or tested certain vaccines in South Africa, that it wasn't as effective as where that particular strain of virus wasn't circulating. We also have in neighboring Brazil a variant that is called a P1 variant, and again that has characteristics of increased transmissibility and it seemed to have increased severity of as well. So variants can pose challenges, especially those variants that are increasing transmissibility, which means that it's easier for people to get infected. And in some cases with these variants, even if you had the infection in the past, you can be reinfected. So again, we don't have any, from the 10 samples that we have sent to CARFA, any indication that any such variant is circulating. But we'll have to send more samples and do the sequencing to be able to identify whether or not they're variants. Now, there are simple public health measures that can prevent you from getting sick. So we got to go back to the basics. And the basics entail that people should wear their mask and protect themselves. If you are wearing your mask, then whether there's a variant or no variant circulating, you would be protected. And if you are not in spaces that are crowded, and if you keep your social distance, then you minimize your chances of getting that infection. And if you wear a mask and keep your distance, it's even better. So we can have a lot of debate about variants and so forth, but if you do the basics, if you keep your distance and wear your mask, and wear it all the time and wear it properly over your nose and your mouth, you are going to prevent the infection from getting to you. And I think that's what we have to get people to understand. And we got to get more businesses to comply. If people are coming into your business and they're not wearing masks and so forth, then you need to insist that they wear masks in your businesses and things like that. In public buildings, people ought to wear masks. So unless we have this culture where people are doing the right things, we are going to have a challenge with infection. Which brings me to another point for those persons who have already received the vaccine. The vaccine does not prevent infection, and I think that's very important for people to understand. What the vaccine would do is minimize the severity. So your chances of going into the hospital or going into the ICU would be less than if you didn't have the vaccine. So it prevents you from getting the most severe form of the infection, but it doesn't prevent infection. That's why when we talk about the efficacy of vaccines, they have different efficacy. And there's still that possibility that with the vaccine, you can get infected, but you'll get a milder form of the infection. So those persons who have already received their vaccines, that's not a license to now stop wearing masks or, going about socializing and being near to people and all of that, because you can still get infected if you do those things.
Yes, sir. NCN is asking, will there be a stricter curfew implemented next month or even a possible lockdown taking into account the steady rise in cases in the country?
Again, it comes back to people's behavior. Because even with a curfew, let's say we put a curfew at 6 o'clock. If people are socializing and without masks and going about their business, between 6 in the morning and 6 in the afternoon, you can still get infected. So it comes back to people's behavior. And if people are doing the right things, then they would avoid infection. And if you don't have business to be out at 10 o'clock in the night or 9:30 or whatever it is, stay home. So it doesn't mean that because you have these hours that you have to be out, wherever. So I think people got to start looking at individual responsibility. And that's what the behavior, people's behavior. I think a lot of Guyanese now should understand everything that as it pertains to this virus and how you can prevent infection. The challenge that we have is, although they have this knowledge, they're not practicing what they know. And that's what we have to insist on, that people practice what they know. You know the mask is going to prevent infection. Wear the mask. Wear it properly. You know that if you go into a crowded area, your chances go up of getting an infection. Stay away from crowds. Keep your distance. So these are things that we have to insist on. And everybody now got to tell one another. When you see somebody not doing the right thing, you got to insist that they do the right thing. And if we all do that, we'll have a change in the culture that we currently see that is happening, where people are a little bit, taking it easy. They don't believe that they're going to get infected, and do the right thing. So we have to insist.
Sir. Well, thank you so much for speaking with us today.
Thank you.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.